Hello everyone, my name is Alexander Valadez, and this is going to be my video project 3, which is actually going to be my last and final video project for the semester. Um, Starting off, I just wanted to say I apologize for the confusion if I'm, performing this on the TV. Unfortunately, Zoom is, I'm having trouble with, having to record it on Zoom. So I just appreciate if, you guys just bear with me. But with that being said, I'm going to get started now. So, as I mentioned before, right now and briefly, I've decided to do my last and final video project on the gastrocnemius. So, what is the gastrocnemius muscle? So, basically, in better terms, in more clear terms, the gastrocnemius is actually our calf muscle. But kind of adding more to that, it is just under your skin at the posterior side of your leg. Now, because the gastrocnemius is close to the skin surface, you can often see its outline. It forms the bulk of your calf muscle. So, as for the origin and insertion, so the gastrocnemius originates on the femur and inserts onto the calcaneus, also known as the Achilles tendon. And as you can see right here up top, we have the origin, which is basically this femur bone, and then the insertion is actually the calcaneus, and that is the Achilles tendon, which will actually be connecting to the base of where the foot is at, basically almost like the back of the foot, I like to say. Now, this muscle has two heads, lateral and medial. Lateral meaning outer, and medial meaning inner. Now, this muscle also joins with the soleus muscle to form the triceps surae, which join to the Achilles tendon as well. So, as for movements and muscle actions, so movements of this muscle include plantar flexion of the ankle and flexion of the knee. So as you can see with the first diagram that was provided right here up top, this is a plantar flexion, and the way I kind of like to describe plantar flexion is actually by having your toes, face toward the ground, and then basically your heel forming almost like a ramp, I'd like to say. And then as for the second diagram right here, this is actually the only possible image that I was able to find with a knee extension. I know this is an actual diagram of hyper knee extension, but still, this is actually the closest that I was able to find to knee extension. Now, as for examples of daily use that require this muscle's actions are walking and jumping. This muscle also supports and stabilizes your legs and enables you to stand up straight, which is actually what I am doing right now, standing up straight. So, going back to a few of the daily use activities and what this muscle is responsible for, is that here we have walking, and in the second diagram we have running. Now, as for strengthening exercises, ways to help strengthen this muscle is by performing more of strength exercises, as I mentioned before. Now, some of those exercises include plantar flexion and calf raises. Now, usually when performing those two exercises that I performed, they actually usually are performed with, usually against resistance. So kind of like either adding weight to the exercise itself or adding a resistance band. So kind of going back to how I said adding usually going against resistance in order to help strengthen that muscle. In the first diagram here, we have a plantar flexion motion being performed here. But as you can see, the lady is actually using a resistance band to help strengthen that gastrocnemius while, performing a plantar flexion movement. As for this diagram right here, these are calf raises. Now, calf raises can be performed in numerous ways. I know some people actually hold usually dumbbells to the sides and, tippy toe, or they'll get a barbell. Basically, a barbell is what, you usually see a lot of people squatting with, and they'll just, raise themselves up, tippy toe again. But with this one right here, this is actually a seated calf raise, and a majority of the weight is actually on the quadriceps, and basically, again, going back to that tippy toe motion. I know you guys can't see it too well, but she actually is using her toes to push, and basically when that is being performed, that is helping strengthen that gastrocnemius muscle. Now, as for stretching exercises, stretching is very essential for our lives, but little does everyone know it is actually more important than, just jumping into performing strengthening techniques right away. And reasons why is because stretching can help decrease the chances of, getting injured. Some stretches that are essential for the gastrocnemius are dorsiflexion of the ankle with the knee in full extension, and heel cords even. Now, going back to how I said with stretching. In the first diagram, we have the leg we actually have the ankle in full, with the knee in full extension. Now, as you can see, I know you guys can't see it too well, but the foot is actually performing a dorsiflexion motion. So a dorsiflexion motion is basically what I like to think of as, the toes touching the sky. So a plantar flexion is having, your foot, down basically, as I said before, toes facing downwards to the floor. But instead, with the knee in full extension, the ankle is actually going up, essentially, so the toes are going up, which making that a dorsiflexion motion. As for the second stretch, we have heel cords. Now, heel cords, I know you guys can't see it too well, but her foot is also in a dorsiflex position as well, and her hands are against the wall. And what she's doing while having her hands against the wall and having one foot in a dorsiflexion motion, she's actually pushing her weight more back, and what that is doing, that is helping to strengthen that gastrocnemius muscle. So, possible injuries. Like anywhere else in the body, injuries can even occur within the gastrocnemius. Now, as I did mention it before, if I did not mention it in my introduction, the gastrocnemius is essentially your calf muscle. Now, this muscle is one that you should not want to definitely one that you should want to take care of more, because the injuries are a few that some do not want to experience. So, in my last slide provided right here, I have a few injuries that I have, that I found and provided, and have, kind of a little bit of experience, well, not personal experience, but I've known people that have experienced, at least one of these injuries. But first injury right here, this is actually a grade 1 injury. Now, essentially, that is a mild stretch. Basically, it's an outstretch of the muscle. I usually get, weird looks sometimes when I tell people that. Because usually, a mild stretch usually happens within the tendon area, but it can also happen within the muscular area as well. And basically, a mild stretch requires an athlete to sit out 10 to 15 days at max. Now, as for grade 2 injury, that's more of a moderate tear. Now, in the diagram here, you guys can't see it too well, possibly, but a moderate tear is actually kind of a slight tear in the muscular area. Now, that's a little more severe, but usually that requires an athlete also to sit out at about usually 60 days at max. And usually that's why, because that tissue and that muscle are having to basically form back, fuse in together again. As for a grade 3 injury, that is a severe tear, and basically what that is, and in clearer terms, that is actually just a rupture basically of the muscle. Now, I know ruptures usually happen, I know that ruptures that usually happen within the lower part of the leg happen in the Achilles tendon more often, or within the ankle even, but as going back to previously in one slide that I said in earlier, the gastrocnemius can also be severely injured, and the rupture is actually one of the more severe injuries which someone does not want to experience, and usually that is having to be reconstructed by a surgeon. And with that being said, that concludes my last and final video project. Thank you.